This is on YouTube. I've gotten all these, I've stolen these off the internet, and we're going to talk about this for a second first. So if you find somebody and you think they've overdosed, first you want to make sure they're not breathing, okay? They may be deep asleep and you can rouse them easily, or you may rouse them and they may go back into unconsciousness, meaning you should assume they're an overdose. But if they are not breathing or breathing very shallow, you know you've got a problem. You should always call 911, and we're going to show you a video that tells you to call 911 after you give the naloxone. I would recommend you call 911 before you give the naloxone. And the reason is, and I've seen this happen, is if in the heat of battle, all the excitement, trying to save somebody, you forget to call 911, you're sitting there, the Narcan is wearing off, and you're saying, "Where's the ambulance?" And you realize you never called the ambulance. And the first time I gave this talk, I spent like 2 days making this video, and I realized that the one thing I left out was call 911, so I had to go back and do the whole damn thing over. So do that first, leave the phone down, and they can help talk you through it. You want to do rescue breaths. Now, how many people in here are trained in CPR? Okay, this is controversial, okay, but even when you look on the CPR website, it says CPR is not for a drug overdose. What you want to do is rescue breathing, which means get the patient to take shallow breaths about every 5 seconds. You don't want to overdo it. If you're young and strong and you breathe into someone too quickly, you can rupture their lungs, and then you're really in trouble. So you want to do a 1-second breath. You want to see their chest move an inch, and we'll show you a video on this. If you see their stomach move, that means you're blowing air in their stomach, so you want to rearrange their head and try and do it again. But CPR itself will not revive somebody from a drug overdose. Then we're going to give the naloxone. You go back to doing the rescue breaths every 5 seconds, and if after a couple of minutes, if they haven't woken up and you have additional naloxone, you can give it again every 3 minutes. Now, the risks of giving naloxone in an overdose are very small. If somebody is physically dependent on opioids and they've accidentally taken too many pain pills, they are going to wake up and they are going to be very, very sick and very, very angry. And one thing you should realize is that gratitude is not part of an overdose rescue. People are usually quite upset with you, so typically you want to get out of the way, okay? And if they are determined to leave, there's not too much you can do about it. So first thing is confirm an overdose. If they're gurgling, snoring, or not breathing, if they have pale skin, if their body's limp, if their lips or fingernails are blue, if you can't wake them with a shout, and don't be reassured by having a pulse. The pulse is the last thing to go, and that's what you want to prevent them from losing. So you can try and arouse them. You do something painful. You rub the breastbone, you pound them under their nose, that's very painful. You squeeze their trapezius, you squeeze their fingers, and if they wake up and then go back down, you assume that that's going to be an overdose and go ahead and treat it. Call 911, put it on speakerphone, lay it down next to you, and then start the rescue breathing. We're going to show you this in a video, we hope. And again, you want to do it every 5 seconds. And this is something that you can order without a prescription. This is a medical CPR rescue mask. It's called the MCR mask. It's on Amazon for $9, and it prevents someone from throwing up in your mouth while you're trying to save them. It's a one-way valve. So you can breathe in, but they can't get out to you, okay? And it also makes it much easier to get a good breath in. And I'll demonstrate it out there on somebody once we get done with this. Then you're going to give them naloxone, and I'll show you the different versions once we get outside. You can give it IM, which is a standard injection. You can give the SVO injection, where you just pop it in and it shoots up in the patient and it talks to you. You can use intranasal, which can either be an atomizer, kind of like nose spray, or the adapt, which we'll show you how to use. And this is the SVO injector. I'll show it to you outside. You can use a safety needle, and this is a great gadget. Everyone is afraid of being stuck with a needle because if somebody is a regular IV heroin user, the chances they have hepatitis C are 75 to 95%. So you want to make sure you don't get stuck with that needle because that's just going to be an additional problem for you. And this is a great gadget where you just push on this little flange. I'll show you outside, and the needle is completely covered. You can use the atomizer, and you can use the adapt spray, And this has the advantage of, number one, being available in drugstores. Otherwise, you have to build your own kit, which we used to do, which was really difficult to do, and you couldn't get all the parts. And it's also 4 milligrams, where everything else I've shown you was 0.4 milligrams, 1/10 that dose. Now, after EMS gets there, be careful if you've got needles lying around. If you don't have them covered up, make sure you don't touch them. Make sure you clean up all the blood, because you have to assume it's infectious. And this is what we call a window of opportunity. This is someone who's going to be taken to the hospital, revived, and hopefully given opportunities for treatment. And frequently, I think a lot of people know this, what they do is they say, here, you know, you're breathing again, here's the number for Don Farm, and they kind of wheel you out into the street, okay? And I have one patient who overdosed 3 times in the same day, and he said the last time he overdosed, they didn't even talk to him. They just put him in the wheelchair and opened the door and just shoved him out, okay? Yeah. So in Washtenaw County and also in Wayne County, what they're doing is they're getting teams together that are available to come to the ER to talk to somebody who's overdosed and see if you can get them into treatment. And we always complain about the government, but the setup here where we have these prepaid inpatient health plans, we have one in Wayne County, we have them in Washtenaw County, they can get people into treatment very quickly. If someone's willing, that's always the big question. And this is an article written by Jason Schwartz. If you don't have his blog, I'd encourage you to look it up. And he wrote an excellent piece on how just Narcan alone was not good enough. And this is my favorite picture, is my wife Kathy. Wave, Kathy. This is our therapy dog, Olive. And Kathy and I have a private practice in Ann Arbor, but you have to spend some time with Olive to get in the back with us. Okay, so, is this going to work? All right. We got.
In this portion of the Pharmacy Pearls Opioid Overdose Education video series, we're looking at how to respond to an opioid overdose. Previously, we stressed the importance of calling 911 for help. Now we'll focus on performing rescue breathing. For a person who is not breathing, rescue breathing is an important step in preventing an overdose death. When someone has stopped breathing and is unresponsive, rescue breathing should be done as soon as possible because it is the quickest way to get oxygen into the body. Steps for rescue breathing are: place the person on his or her back and pinch their nose. Tilt the chin up to open the airway. Check to see if there is anything in the mouth blocking the airway. If so, remove it. Give 2 slow breaths, blowing enough air into the lungs to make the chest rise. Turn your head after each breath to ensure that the chest is rising and falling. If it doesn't work, tilt the victim's head back more. Breathe again every 5 seconds. When performing rescue breathing, you can use a CPR mask or mouth barrier containing a one-way filter valve to protect yourself from the victim's potentially infectious bodily substances such as vomit or blood. Finally, rescue breathing should be continued until the person can breathe for themselves or until help arrives. Thanks for watching. Please stay tuned for the next edition of the Pharmacy Pearls Opioid Overdose Education video series.
Nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability.
So does anybody have any questions or comments?